Welcome everybody, and of course I have to sneeze right as I start the recording here. So I apologize if I go off camera for a second, then you'll know what I'm doing. We'll give it just a couple more seconds. I see that attendee count climbing, and then we'll get started. Great. Well, thanks everybody for joining us today. We're so thrilled to be able to partner with the Insure, the Uninsured project, or ITUP for short, to bring you today's Government 101 workshop, which is going to focus on breaking down the state legislative budget and administrative processes. And unlike other government trainings that you may have participated in, I think this one is really special because Katie and Marissa are also going to help us understand the rules for engagement. So I won't spend too much time on the intro. I do want to welcome our amazing presenters. So first we have Katie Hydorn, who's ITUP's executive director. And prior to joining ITUP, Katie spent 2 years as a government affairs advocate for HealthNet and served as department director and policy lead at the nonprofit California Coverage and Health Initiatives. Katie also served in the Brown administration at the California Health and Human Services Agency as an assistant secretary of program and fiscal affairs and health reform, and as the governor's appointee in the Senate confirmed position, Deputy Secretary of Special Programs. And prior to her service in the Brown administration, Katie was a principal consultant for health policy in the California State Senate Appropriations Committee. And so she's got a really good perspective on both the administrative and the legislative processes. And her counterpart today, Marissa Kranak, I hope I said that right, Marissa. I apologize, should have checked about the pronunciation. She's the Director of Health Policy Research at ITUP, and she works closely with Katie and the policy team to develop and execute ITUP's policy research, analysis, and communications. And before joining ITUP, Marissa was a research analyst with the Educational Results Partnership. She also served the California Council on Science and Technology Fellow in the California Assembly Health Committee. So we have just two really, really great speakers today. And yeah, I'm going to bring them up and I will fade away into the background.
Hi, everyone. Thank you so much for having us today and really appreciate Maria's partnership on this, where Marissa and I are so excited to be here today to walk through this training with you, and are really looking forward to sharing a little bit about our organization, Insure the Uninsured Project, as well as our insights into the legislative, budget, and administrative processes. I just want to say at the start, we're going to do some brief Q&A. We have 3 sections for you of this training. We'll do some brief Q&A after each of them. We also have a survey because we want to capture what you're learning throughout this presentation that Maria will be launching. So we'll cue her in when we're ready for that. And then at the end of the presentation, we hope that we'll still have some time for any questions that you didn't get to ask. And then, of course, Maria will make not only the PowerPoint available, but also our email addresses if you have any follow-up questions or information too. So with that, Maria, thank you so much for the wonderful introduction. You now know all about me. And I'll tell you a little bit about our organization. So our mission is to promote innovative and workable policy solutions that increase healthcare access and improve the health of all Californians. And we implement that vision through our policy-focused research, broad-based stakeholder engagement, and trainings like these. Our vision is that we believe all Californians should have a fair opportunity to live their healthiest lives. Next slide. ITUP values: we seek a health system that is universal, equitable, accessible, effective, and affordable for all. Next slide, please. So each year we have a lot of activities and things that we do. Each year we host an annual conference. Some of you may have actually participated in this or attended in years past. We are going into our 27th annual conference in February of 2023. And we're really hoping that we get to be in person again this year. For almost 25 years, we were in person, and then the last 2 years, we've held our conferences virtually. But we're really excited about it. We bring together people from all across California, typically 600 people together, to come together and talk about the latest and greatest in health policy. And this year, we were happy to say that we had a wonderful panel about aging well. and moderated by Dr. Sarita Mohanty from the SCAN Foundation, and are just very happy to have their partnership and Maria's partnership as we continue to build on that work that we started during that conference panel. So we also host what we call 360-degree policy forums. We have government officials, state level advocates, and then we try and bring in local voices, folks like you all, to the conversation, so that we're really painting a picture that when we talk about policy, it involves everyone from government to statewide advocacy to local organizations doing the work and serving consumers. We also happen to run a dozen working groups across the state. We go all the way from San Diego to LA, all the way up to Humboldt County, and bring people together at the local delivery system. So stay tuned for those. Those are coming up in June and July, and we welcome all participants in the healthcare delivery system to attend those. Those are usually attended by local hospitals, counties, clinics, health plans, and community-based organizations. So it's a great opportunity to this year to talk about community-based organizations and how they're interacting with health plans through community supports and CalAIM. So should be really exciting conversations. And then we also produce fact sheets. We produce lots of resources, one of which you will be using at your Advocacy Day next week. We have decided that instead of doing in-depth issue briefs, we actually focus more on infographic level fact sheets. They're high level, they're easy to read. They're meant to really focus people in on key terms, program information, and policy considerations, because we are in the policy world. So we'll make sure that some of those are made available, but if you'd like to see them, you can go to itup.org, and we've got a wealth of information on there. We also have 3 key focus areas that we work in: coverage and access, delivery system transformation, and the future of health. Coverage and access, we work to ensure the uninsured and make that coverage meaningful. Delivery system transformation for us looks a lot like CalAIM and working in and around that space. And then the future of health for us is really focused on telehealth, virtual care, data exchange, and broadband expansion. Next slide, please. So for our, and thank you so much, Maria. We have developed a Medicare fact sheet that also includes some social determinants of health data. So it talks about not only the Medicare population and dual eligible population in California, but also talks about their housing needs and food security needs as well. And then we have a handy dandy infographic on the master plan for aging, because I think that's really, as you all know, the blueprint for where the state is going in these issues. And we really want to make sure that that is tied into the broader health delivery system. So for our training agenda today, we have 3 pieces: legislative bills, administrative rulemaking, and the budget. And we're going to do an overview of each of those processes. We're going to talk about when to engage in those processes and strategies for how to engage, because knowing the process is really the first piece, but then you need to know when to go in and interact with staff in the legislature or in the administrative branch to actually pull those strings and get in at the right time to influence the process. So that's what we're going to walk through today. Next slide, please. So here's just a high-level slide for the 3 branches of government, the 2 branches of government that we're going to talk about today. So the legislature, they pass laws and resolutions, they give input to and approve the state budget, and then they hold informational, policy, and fiscal hearings on bills that have been introduced in the legislature. So we'll talk through all of that. And then we have our second 2 processes actually both involve the executive branch. You have agencies and departments. They report to the governor. They create and administer and evaluate programs, and they develop all those rules and regulations where they take stakeholder input, and you can engage in those processes too. And then the governor has not only those functions, but also has some specific ones. He obviously signs and vetoes bills. He also proposes and signs the state budget and does administrative appointments as well. Next slide, please. All right, and with that, I'm going to turn it over to Marissa to walk through the California legislative process. Go ahead, Marissa.
Thanks, Katie. And before I get started, Maria, thank you. If you could fill out these polls, they're going to pop up throughout the training. They're really just to collect data on where you're at before the training and how much how effective some of our materials are. So thank you for taking the time to do those. So I'm going to talk through the California legislative process. So our California legislature is a full-time legislature. So what that means is that all of the California Assembly members and senators are full-time staff. They're essentially full-time staff of the state. They work year-round on policy, and they typically have decent staff and pretty good salaries. That's as opposed to a part-time legislature, which actually there's only 4 states that have a truly full-time legislature in the nation, and California is one of them. Part-time legislatures vary as to how much engagement and time and salaries and things like that the legislature has. The California legislature is a 2-year legislative session, so bills can be moved through the process for up to 2 years. And in our California state legislature, there's 80 assembly members, each serving 2 years terms at a time, and 40 state senators that serve 4-year terms at a time. And term limits across both houses is 12 years total. Next slide, please. So the legislative calendar is where you can find all the legislative and the budget deadlines. And we're gonna talk through different pieces of that timeline throughout the presentation, but we put links here in the PowerPoint so you can find the legislative calendar when you need it. Next slide, please. Some of the key deadlines that we're gonna talk a little bit more about are the bill introduction deadlines, policy committees, fiscal committees, House of Origin deadlines, and the sign and veto. And then other things to pay attention to is when does session end and when are legislative recesses. Next slide, please. So I want to start first with what's happening before any of these deadlines hit. So before the bill introduction deadline, starting really at the end of the previous year's session, legislative offices are working hard to determine sort of their legislative priorities for the year. So that means they're gathering ideas, they're talking to stakeholders, they're drafting bills, stakeholders are pitching bills. And so this is the best time to take your ideas to the legislature, is when they're trying to form these ideas and getting the drafting done. So bills, all bills are authored by legislators. Sometimes when stakeholders take bills to legislators, they can be what's called a sponsored bill. And a sponsored bill is essentially, say an organization like the California Medical Association takes a bill to a legislator and sponsors that bill, then they do a lot of the work getting support for the bill for that author's office. There's a variation among members as to whether or not they will do sponsored bills. Some do not, some do. So it's just dependent on the legislator themselves. Once a bill has been introduced, it must be in print for 30 days before any action can be taken on it. So that gives the public time, that 30-day window to take a look at what's been introduced. In that time, bills are referred to the Rules Committee, which is a committee that will dole out, they'll decide which policy committees a bill needs to be heard by. So that could be one policy committee, or it could be what's called double referred or triple referred, where it is referred to two or three different policy committees. Next slide, please. So who makes up a policy committee? Each of the policy committees, and we listed out some of the key health policies. So health and the Senate and Assembly health committees, Senate Assembly Human Services Committee, and then the Assembly actually has a specific committee designated for aging and long-term care. So those are made up of a small group of legislators. Ideally, they have interest and a better understanding of those policy areas, and they're assigned by House leadership, which would be in the Assembly is the Speaker, and in the Senate is the Pro Tem. Next slide, please. So the main functions of a legislative policy committee is to set public hearing on the bills that have been referred to them. And at these public hearings, which the policy committees conduct, there's a publicly available bill analysis, which is comprehensive. What does this bill do? How does it amend the law? What are things to consider? What's some literature behind the policy? So those are all made publicly available, and they're put together by committee consultants. There's also testimony. So that could be, there's usually longer stakeholder testimony for support and opposition. And then there's what we call Me Too's, or where you can go and be on the record and say, hi, my name is Marissa Kranak with ITUP, and on behalf of ITUP support AB, whatever the bill number is. And that's on public record. And this is also where members of the committee vote to pass that bill on to the next part of the process. So some of the motions are, you do pass, which means that as the bill is in print, it passes on. Do pass as amended, the bill still passes on, but only if the agreed upon amendments are put in print. And then do not pass is a no vote, and abstain. And to pass through committee, a bill needs a majority vote. Next slide, please. So this is just an overview of sort of of the steps of a committee process. So I talked a little bit about that the Legislative Rules Committee assign the bills. Then during the analysis phase, this is where the policy committees, they read the bill, they make sure that the bill, number one, does what the author intends it to do. And if it doesn't, how does that need to be changed? They analyze the policy and who's it going to impact, and talk to a lot of stakeholders in that process. So this is a good place for folks to engage as well. And then the committee hearing is when the members will vote. Next slide, please. A couple of important policy committee rules to be aware of. There are two different ways to amend bills in policy committee. The first is what we call author amendments. And so author amendments are amendments that are actually in print at the time of the hearing. And so those amendments, they still need approval by the chair, but they don't need to be voted on. They're in print before they go to the hearing. The second kind is for the do pass as amended. So if the amendments don't get adopted before, they can be adopted by vote from the committee members. And in order for author amendments to be taken, they have to be in print for 72 hours before being heard. Next slide, please. After the policy committees, after everything passes through those, the next step is in the calendar is legislative fiscal committees. So there are two major fiscal committees in the California legislature. So the first, the budget committee, which we'll talk about a lot more in depth a little bit later in the presentation, is their main job is to focus on the budget bill. So the bill that will become the budget, that is the bill that they're reviewing and amending. That's the bill that all the budget committee hearings are about. And the budget committee hearings have input from the administration, legislature, and stakeholders. And then there's the appropriations committee, which reviews, amends, and votes on policy bills. So those are any of the bills that just went through policy committee. If I'll talk more about how they're key fiscal, but if they have an impact on a fiscal impact, then they go to the appropriations committees. And it's important to know that both of these committees depend on available state revenues. Next slide, please. So with the appropriations committee, there's a couple things to talk about. So the suspense file you may have heard that term before, is anything that's key. There are different rules for the Assembly and the Senate. And so in the Assembly, any bill that is keyed to cost $100,000 or more from any fund, that could be the state general fund or special funds, federal funding, then that goes on what's called the suspense file. Anything less than that amount in the Assembly goes on what's called consent, and it still gets voted on in committee to pass through to the next phase. And in the Senate, the rules are a little bit different. So any bill with an annual cost of $50,000 general fund or $100,000 federal or special funds goes on the suspense file. But the Senate has a rule, the 28.8 rule, where any bill that has a cost of $50,000 or less total funds can actually just bypass Appropriations Committee and go straight to the floor, which is the next part of the legislative process. So suspense, if you can go back to that slide. So the suspense file hearings, they're generally the last hearing before the fiscal deadline. And if a bill is what's called held on suspense, that means it does not move forward. It cannot move forward, and it must be reintroduced in another legislative session in order to be talked about again. Next slide, please. So this slide is really kind of an overview of the process. So far we've talked about the bill introduction deadline, the rules committee, policy committees, and fiscal committees. So after bills make it out of the fiscal policy and fiscal committees, then they go to a floor vote. And so the House of Origin is the house that bill originated in. So if it's a bill introduced by an assembly member, House of Origin is the Assembly. If it's a bill that was introduced by a senator, the House of Origin is the Senate. It passes through that house. And then it repeats all of these steps again in the second house. Or it goes back to the policy committees and fiscal committees in the second house. From there, if there's no amendment taken and it passes through the second house, the bill goes to the governor's desk. If there are amendments in the second house, the bill could go back to the House of Origin on what's called concurrence to make sure that the other house is okay with those amendments. And then it will go to the governor's desk. Next slide, please. The final stage in the process is when a bill becomes an enrolled bill, which means it's on the governor's desk. So at this point, the administrative and the executive branch can now weigh in and produce what's called enrolled bill reports, which are a summary of the bill and its policy and fiscal impacts presented to the government to kind of help him in deciding whether or not which action he should take or they should take. And so the governor has 30 days to either sign a bill, which then it becomes law, veto the bill, it does not become law, and the third option is to leave it on the desk, which is the governor doesn't sign it and it becomes chaptered and becomes law without his or their approval. Next slide, please. So that was kind of the legislative process, but the next section, I'm gonna kind of go through some strategies for engaging on legislative bills. Next slide, please. So these are some, you're gonna see this slide a couple of times, and these are some effective tools and strategies for engaging at any of the different levels that we're talking about today. So there's coalition buildings, meeting with legislators and department directors, letters of support. You can also create educational materials to help inform members of a particular problem or how things work, things like that. And then there's also social media as an important engagement tool. Next slide, please. If you want to engage with the legislature with an idea that you have, so for example, say you wanted to change staffing ratios for a certain healthcare facility, right? You can, if you want to have a legislator sort of have the best chance to hear your hear your ideas and possibly run a bill. Fall is the time to do it, and preferably before Thanksgiving. So you can meet with legislative staff, and that's a good timing. And when you meet with staff, you want to have a clear sort of elevator pitch. So I pulled out some different pieces of a really good elevator pitch. You want to make sure you communicate who you are, what the problem and why it's important to that legislator. Why would they care? And why does it impact their community? And then you always want to end with a clear ask. What are you asking them to do? Next slide, please. If a bill is already introduced and you want to engage or weigh in on bills in that way, the policy and fiscal committees, in the policy and fiscal committees, you meet with committee staff before the bill is set for hearing, so you can monitor the hearing dates on the committee websites. And so you want, from the time the bill is introduced, you want to use that time to meet with committee staff and talk about what your thoughts are in that bill, whether you think it can be changed and how, etc. You can go to the hearings and provide public testimony or Me Too statements. You can write support and opposition letters to be included in the bill analysis. So this also needs to be done before the hearing, if you want it to be included in the analysis. You can also use social media and op-eds as a way to engage as well. Next slide, please. If the bill is on the floor, it's kind of very similar. You can meet with legislative staff after it passes through policy or fiscal committee and before it's taken up on the floor. You can write support and opposition letters. These are often called floor alerts. And then social media and op-eds. Next slide, please. And something else that you can do is you can build relationships on the local level. So each legislator has district offices, and you have local representatives, elected officials that you can engage with to communicate what issues you're seeing, and so the more you meet with those representatives, the better those relationships build, and they can help elevate your voice to the state capital level. So you can also invite district representatives and district directors to local events in your community. And as I mentioned, the frequency, the more you do it, the better the outcome. Next slide, please. And this is a slide I put together. So the vertical axis is actually impact on public policy. And so this is some different ways that you can engage. The x-axis is the effort and time commitment that these items take. And so I just want to point out that the more you do, so the more you meet with your legislator, the higher, or the further right and higher up on this chart that item goes. If you can organize a group to meet with the legislator and facilitate something on social media, that's a more time commitment, but it's pretty powerful. And the more times you do that, the better. Next slide, please. And then finally, the governor's office is another place you can engage throughout the legislative process. So during the first policy committee hearing, before the first policy committee hearings, you can meet with executive branch departments and the Department of Finance, which is the Department of Finance is the governor's financial advisor. And you can also meet with governor staff. And then you can also, you can take amendments to address some concerns that you're hearing. And then when the bill goes to the governor for signature, you can send what's called a sign and veto request letter to the governor. And you want to make sure that on that letter is the relevant governor's office staff. Next slide, please. And then I'm not going to go through these slides, but we put together some definitions in case they are helpful. Next slide. And next slide. So before I hand it over, I'm going to cue Maria for our poll for after the legislative session, and I'm going to hand it over back over to Katie.
All right. Thanks so much, Marissa. Really appreciated you walking through all of that. I just wanted to see if anyone had any burning questions before we move on to the budget process. Also, absolutely fine if folks want to just take all of this in and have and ask questions later. Feel free to use the Q&A function, and Maria will help us work through that. And then also please feel free to use the chat function as well. I see one question in here from Charlotte. Do you have priorities regarding which type of social media we use? For example, Twitter versus Facebook versus Instagram, or all of the above, all of the time? The answer is yes, all of the above, all of the time. But if you're one individual, certainly I know I don't want to be on my phone all the time. I don't want to be on the computer all the time. Certainly, and I think the professional world where you're going to find legislators, policymakers, and like state departments paying attention, you know, when you tag them or retweet a lot of their tweets or statewide advocacy groups, you'll find, I see Emily from our team has said it's all about Twitter. It is all about Twitter, but it's also all about LinkedIn. I know certainly during, I'm seeing a lot of professional engagement on LinkedIn as well. So I'd say, you know, if your targets are policymakers and advocacy groups or elected officials or state departments or local departments, I'd say Twitter and LinkedIn are going to be your best bets for your time. Facebook and Instagram less so, although if you're really active and your network's really active on those social media platforms, then I would go with that. But I'd say the two big ones are Twitter and LinkedIn. If you do run an organization, there are also, and we'd be happy to follow up with you on this, there are services that we use and we know other organizations use where you can actually create a social media post and then it'll blast it out to all the different platforms. So it really saves you or your team members time. So that's something else you can think about too. And then we have a question here. Can you clarify how a bill gets out of the suspense file? Marissa, you want to take that one?
Yeah, so unfortunately, if a bill is keyed as being on the suspense file, so those appropriations limits that I mentioned before, the bill doesn't get off the suspense file, then it's up to sort of member priorities of which bills pass and which don't. So there's only a certain amount of money every year, and the policy areas get prioritized, and so you can engage with engage with appropriations committee staff and talk about how important your bill is and things like that, but you can't take the bill off the suspense file.
Yeah, Maria, that's a great question. I'm also just looking through the chats here. My apologies if I don't get to all of them. How many bills each year are introduced and passed? Typically there's a bill limit, anywhere from 30 to 40 bills. Typically, they change it year to year.
50, yeah.
50 this
right
year.
Right now it's 50 per 2 years.
Yeah.
Per legislative session.
So each member gets to introduce 50 bills per year. So if you divide that in half, you might have an assembly member introducing 25 bills this year and 25 bills in the second year. And then the number of introduced versus passed. And then there's the signed, right? So there's the introduced, passed by the legislature, and signed. I mean, I would say usually we're getting about, about 1,500 to 2,000 bills a year, I think. Probably closer to 2,000 bills. And then if you in one house, and then if you add the second house in, you can do the math. So it's a lot. There's a lot to be tracked there. But that's across both houses and across all policy areas. So those are the numbers that are introduced. But I would say passed, I think it's roughly like 80%. I feel like signed is about 75%. It's pretty high. Marissa, do you have, I don't have exact numbers. I know sometimes folks calculate that.
I don't have exact numbers, but that sounds about right.
Yeah, give or take.
And then
5%.
less will get signed, essentially.
Yeah, fewer get signed, but still a lot. Usually you'll find there's kind of a strategic consideration of whether or not you send a bill to the governor. If you know the bill is going to get vetoed, sometimes people will send the bill to the governor and let it get vetoed so you can see what the veto message looks like. Or sometimes people will say, no, we'll wait for the second year of a session, so we'll keep it in the legislature. And then sometimes they'll choose not to send the bill down. So that also impacts the bills that are signed. But most of the time, you're not going to send a bill down to the governor that you're not expecting to be signed. So I'd say it's about 75% of introduced bills-ish get signed. That being said, the content, and the content looks different. So what's actually in the introduced bill looks really, really, really different from what is typically signed. That's also something too. I'm just looking here.
There's I'll jump in to help because I know
Maria,
it's kind of hard, but there's a question here about the calendar. So if our group identifies priority legislation introduced by legislators, when is the best time to identify the 6 or 8 bills on the list? And when is the best time to send a delegation to the legislator's office to lobby?
Marissa, you want to go ahead? Or I can take this one if you want.
Do you want to take that one?
Sure. So if your group identifies priority legislation introduced by legislators, every year there's a bill introduction deadline. It's typically in mid-February, right after Valentine's Day. And then you have that 30-day wait period. So bills introduced in mid-February, and then you have about 30 days to, quote, read the bill. And that's the time between when it's introduced and its first policy committee hearing, which usually happens in March or April. That's the time. So what I would recommend you do is look on the legislative calendar, know when the bill introduction deadline is. It takes them a few days to process it all and put it all up online. But the week after that, the 2 weeks after that, like the last 2 weeks of February, that's when I would be going through and identifying your priority bills. And then in the 2 weeks after that, you're going to be calling your team members, maybe putting a coalition together in support of a bill, joining coalitions in support of a bill, joining coalitions in opposition to bills, but in that time frame. So within the 2 weeks after the bill introduction deadline, identify your priority bills, and then the 2 weeks after that, I'd be working to get support letters, opposition letters, coalitions, and starting to meet with those legislators. We're going to go with one more question, and then I think we'll need to move on.
Right, and I just want to check out David Wilder. It looks like you've had your hand up for a while, so I'm not sure if you have a question or you were just saying hello. Some people like to use that feature to sort of wave in the virtual space, but I'll open your line, and if you do have a question, just feel free to unmute.
Yes, yeah. I do. All too often what I'm finding nowadays is that the ADA is no longer even given lip service. None of the platforms that government is using right now are accessible to screen reading software. So I can't read what you don't read. So if you read a sentence and it's actually a couple of paragraphs, I'm missing out on information that I would otherwise have available to me. This is getting to be a problem because it's separating even wider the gulf between people with disabilities and their government or private companies that are supposed to be providing them information.
Thanks so much for elevating that. And I know that you and I have been exchanging stuff in the chat, but I want to say that we are going to create an accessible version of the PowerPoint, accessible to screen readers. So I encourage you to take a look at that next week when it comes out, and just let me know if there's something that's not kind of reading right or is not working right. We'll go back and we'll fix it, David.
Thank you for responding in the chat, but I can't read the chat.
Oh, okay. Thanks for flagging that, David. Thanks for flagging that. Yeah, so just rest assured, we'll get that out to you and we'll make sure that it's accessible for screen readers, and feel free to reach out if there's anything else we can do to be supportive.
Thank you.
Thank you. All right, and I will look to Katie and Marissa to see if we want to kind of move on to the next segment, And just say that for folks who have additional questions, there will be more time for Q&A, especially at the end. We'll save some time for Q&A, and we'll kind of find a way to follow up if there are questions that we haven't had a chance to answer.
Absolutely. And thank you, Maria. And we could absolutely talk about this all day. So thank you for the time check. I saw one last question that I really wanted to address here, that Mel asked a question in the chat. There was a bill that was vetoed by Governor Brown, but was signed by Governor Newsom. Is this common? Absolutely. Politics change, public opinion changes. So and it takes a long time sometimes for bills to get passed. So you might introduce a bill, maybe it doesn't get out of the first policy committee one year. Then you introduce it again in the next 2-year session and it makes it to the appropriations committee, but it dies. And then in a year like this, when we have a lot of money in the budget, you introduce another bill and it gets all the way to the governor and gets signed. So it can take, it's an iterative process. And in a lot of ways, there are no new ideas. They just get recycled and repackaged over time, working through coalition issues, policy issues, et cetera. So yeah, we see that relatively often. All right, I'm going to move on. So next slide, please. We're going to talk about the California state budget. So there are some key timelines in the California state budget that are also published in the state legislative calendar. And again, thank you, Maria, for putting up that survey. For those of you who can see the survey, please go ahead and take it and tell us what you know about California budget process. And then at the end of this, we'll ask you again. Hopefully you know more. So for the budget timeline, this runs in parallel to the legislative timeline, to the legislative bill timeline, but the committees through which the budget bill goes are different from the policy committees that Marissa just walked you through. So the key dates in the budget timeline, this happens every year. So California's fiscal year is from July 1st through June 30th. Interestingly enough, the federal fiscal year, so what the federal government does, their fiscal year is October 1st through September 30th. So when we're using money in budget terms, the federal government's money comes to the state on one timeline, and then the state's money is spent on a different timeline. And of course, both of those timelines are different than calendar years, just to make this all more complicated for all of you. But to know the California fiscal year is July 1 through July 30th, and you'll see in June 30th, and you'll see as we go through this process, that timeline, that fiscal year timeline drives different pieces of the budget process. So every year, the governor works the state agencies and departments to develop a budget, a proposed budget, and it's constitutionally required to be released, that draft budget, on January 10th of every year. So if you hear us talk about the January budget or the Jan 10 budget or the governor's proposed budget, that's what the governor and state departments have released on January 10th. It's almost like a holiday for people in the policy world. Everyone sits there and watches the governor's press conference and goes, "Ooh, what's in the state budget?" And they publish both a big summary document that's called the A pages. I don't know why they call it the A pages, but they call it the A pages. It's a summary document, and then it has chapters that are issue specific. So you'll see a COVID recovery one, or a housing and homelessness summary document, a health and human services summary document, and an education summary document, along with several other policy topic areas that'll tell you the details. And then there's a bigger budget document behind that has even more granular details of how the governor's proposing to spend the state's money for the next year. So January 10th, the proposal comes out. Oh, sorry, can we go right back to the slide? Thank you. So January 10th, proposal happens. And then we'll get into this, but there are a bunch of legislative hearings that happen between January and mid-May. In mid-May, after April 15th and all of the tax receipts come in, the state likes to count its money so that they know exactly how much money they have to spend. They do a May revision of the budget. And so in mid-May, roughly May 15th, they release an updated version of the budget based on those tax receipts. And then the Constitution requires the legislature to send the budget bill by June 15th to the governor for signature. And then typically the governor signs the budget in time for the new fiscal year to start on July 1st. Next slide. So what is So we talked a little bit about the January 10 budget. So what is the May revision? I just kind of went through that. But the May revision is that updated estimate of the revenues, sort of in real terms, what does the legislature and the governor have, what revenues are available to spend, not just projections anymore, but we know how much money we brought in. And there are updated requests called May revision letters and updated estimates as well for certain programs. Next slide, please. Back one slide. Perfect. So where do we find all of these budget documents? The Department of Finance's website. The Department of Finance reports into the governor, and they are the arbiter of all things budget. Sometimes they're even termed a quote control agency. They have control over the state budget. All of the agencies and departments in the state, all their budget requests go up through the Department of Finance, and then the director of the Department of Finance works with the governor's office and the governor to determine what's going to go in that final document. So you can find the summary documents I talked about and the detailed budget all on the Department of Finance's website. Some of the departments publish summaries of their pieces of the budget, and I think some relevant departments for you all: the Department of Healthcare Services, which runs the state Medi-Cal program, the California Department of Public Health, the California Department of Social Services, and then the California Department of Aging, typically all create what they call highlight summary documents. So they provide a little bit of extra information. You can find those on their websites. And then also the legislature has a group called the Legislative Analyst Office. They report to the state legislature, and their whole job is to analyze the state budget and provide that fiscal analysis to the state legislature. They're separate and apart from the Department of Finance. So the Department of Finance reports to the governor, and the Legislative Analyst Office reports to the legislature. And they both Department of Finance and Legislative Analyst Office staff typically testify and give details on the budget in budget hearings. Next slide. So how do we get to the budget? How do we know what goes into the January 10 budget? So what's really interesting is that about 6 months before January 10th of each year, the state departments, state agencies, and state departments actually start building the budget. It's a year-long process, but it's not released to the public until January 10th. So these entities produce a lot of documents and a lot of process that start with budget change concepts. So if a department wants funding for a new program or a particular program, they produce something called a budget change concept in June or July of a year prior to the January 10th, so 6 months prior to the Jan 10 budget release. If their agency approves those budget change concepts, they actually build that out into what they call a budget change proposal. These are long documents that have policy reasoning, what it costs, the types of state staff that they need to implement the program. Those budget change proposals, or we affectionately call them BCPs, they're reviewed by agencies, they're reviewed by the Department of Finance in August and September, and then those go to the governor for decisions in the fall prior to Jan 10. There are also these things called local assistance estimates. You might have heard someone refer to, quote, an estimate. Anytime a state department sends money to counties or local entities to implement or do a program, they have a local assistance estimate. Most programs don't have these, but some big ones do. The entire Medi-Cal budget is in a local assistance estimate. Department of Public Health has some local assistance estimates, as well as the Department of Social Services. So happy to provide some links as follow-up to that. These are just an example, the Department of Healthcare Services, the Medi-Cal local estimate is over 200 pages long. There's a lot of really good information in it, but it's really, really complicated and intense. But these exist, and the folks who are doing budget analysis love getting these. These estimates are sent to the Department of Finance in September and October for approval, and then they're approved by the governor's office in November. So you'll see them when they're listed on the department's websites. You'll see them as November estimates, and then they update them for May revision, and they're called May estimates. There are two other opportunities for agencies and the departments to submit requests for funding for new programs or to update funding for programs. They're essentially budget change proposals, but instead of budget change proposals released on January 10th, they're actually released in April, on April 1st. So if you see an item called an April 1 letter, that's what it means. It's a budget change proposal, but it was released in April instead of in January. And then the same thing with May revision letters. There are May revision letters, which are BCPs that were released in May. In our parentheses here, you don't just say, hey, I've got a proposal that I want to put out on April 1st. The departments actually start developing those in the fall, and they go to agencies and Department of Finance for review and approval in February, and then they're released April 1st. Same thing with May revision letters. Those are reviewed they're developed over the winter, and they go for approval in April, and they're released in May. So you're kind of getting a theme here. When you see something that's released publicly, usually there are months of work put in internally behind the scenes before they're released publicly. So as we talk about engagement, just keep that in mind. Next slide. So we talked about each of these. I'm going to skip over these slides, but there's just a little bit more information here on budget change concepts. Next slide, please. Budget change proposals. We go a little more in depth. And next slide, please. And then local assistance estimates. There's a little more information there for you as well. Next slide. Same thing with spring letters. And then next slide, please. And May revision letters. Next slide, please. So now that we've talked about agencies and departments' role in developing the budget, we get to talk about the legislature's role in the budget, which is really probably the process that you might have seen or been familiar with. So once the budget is released on January 10th, the legislature and stakeholders say, goody, I get to review all of that. They read all the summaries, they read all the estimates, and then the state and then the legislature actually has designated budget committees. So in the Assembly, it's called the Assembly Budget Committee. And then they have several subcommittees that are issue specific. So in the Assembly, their subcommittee number 1 is the Health and Human Services Subcommittee. And they review all budget proposals related to health and human services. And then in the Senate, their committee is actually called the Senate Budget and Fiscal Review Committee. And their subcommittee number 3 is the Health and Human Services Committee. They have typically have staff have a consultant assigned to each subcommittee. So there's a staff person who handles Health and Human Services Committee analysis, and they will analyze every part of that January 10th budget proposal that relates to health and human services. They are assigned item numbers. And those item numbers are analyzed and put into a written, publicly available agenda that each of the budget committees makes publicly available right before the hearing. And then at those hearings, you can actually testify. As Marissa said, it's similar to a bill hearing. You can testify on a budget item and support it, oppose it, ask for amendments. Pro tip here, definitely call the budget committees to understand when an item that you might be interested in is being heard, and make sure you know all of the deadlines. They'll be able to tell you all of that. Next slide, please. So this is just a bit of a summary of the legislature's role in this. I like this visual. So February through May, the budget committees hold hearings in those subcommittees on the governor's January 10th proposal. In May and June, the May revision comes out in mid-May, and they hold one very quick week of hearings in each of the subcommittees. And then in June, there are a lot of behind the scenes meetings that happen between May and June. And then the legislature decides to pass the budget bill by June 15th, or they don't get paid, and they don't get to go on summer recess. So the legislature has a big incentive to pass that budget bill. So behind each of these boxes, there's a lot of process, there's a lot of stakeholder engagement. And those are the places where you'll want to engage. There's something on here called stakeholder proposals. So the governor and state departments create the January 10 budget, but there are a bunch of stakeholders like all of us who may want to spend some of that budget money on a new program or something like that. Each of the Assembly and Senate budget committees have a process for how they accept stakeholder proposals. So, for example, the collaborative might say, we have a budget priority. We want $5 million to run a learning collaborative for community-based organizations. And they would put that in as a quote, stakeholder proposal for consideration by these committees throughout the budget process. Next slide. So just the process, they're identical budget bills that are introduced in both the Assembly and the Senate. The authors of those bills are either the committee chairs or the committees themselves, and only one of those bills ultimately becomes the Budget Act. One of them will die, and then they'll actually act on one of those bills. The final budget bill is actually voted on and approved by the legislature with at least 50% of the vote, but it takes effect immediately. Usually to have a bill take effect immediately, it's an urgency measure and it requires a 2/3 vote of the legislature. But about 10, almost 15 years ago now, California voters passed a proposition that allowed the legislature to pass a majority vote budget because we were having lots of delays, and the state budget the state didn't have money to spend, so they changed that. Next slide, please. You'll also hear about something called budget trailer bills. So the budget bill is literally the name of the program and bullet points underneath it that say you will spend X amount of dollars on X program. But as you all know, policy is much more complicated than that. So we have these things called trailer bills. So you have the main budget bill that has literally appropriations in it. Spend $5 million on the Department of Healthcare Services, spend $5 million on the Department of Public Health. But then we have these separate bills called trailer bills. There's a health trailer bill, a human services trailer bill, an education trailer bill, et cetera. And those trailer bills have policy language in them, statutory language that implements the budget bill. They don't have to be passed by June 15th. They don't have to be in place by July 1st, even though typically they are. But these quote trailer bills, or TBL, trailer bill language, those also go through the budget committee. The budget committees, they don't go through the policy committees, but they are the policy that implements the budget bill. Next slide, please. So I know there was a lot there, but there's also a lot of opportunities to engage in the budget process. So next slide, please. As Marissa said, you're going to see a lot of this slide. Instead of supporting a policy bill, Senate Bill number 4, for the budget, you support item number 3, right? So you have items. But the same thing happens that you do with policy bills. If it's a top priority, you try and build a coalition or you sign on to a coalition, letters of support and opposition. You can meet with legislators and department directors in the Department of Finance prior to hearings on the bills. And then you can create and disseminate educational materials if it's a complex topic. And again, you can use our favorite tool, social media. Next slide, please. So engaging with the administration. Remember how we said that the administration actually spends 6 months prior to January 10th building that budget? It's important to meet with those administrative staff 7-8 months before the budget release if you want a change or increased funding in a program. So you really have to meet with them in May. And I know you're saying, well, Katie, we haven't even passed the current year budget. Yes, that's true. These things happen in parallel. So the administration staff, the department staff, they're already thinking about next year's budget while they're in the process of creating the current year budget. But definitely recommend engaging with them. That can be a staff member that you work with. That usually people will start with the deputy director of legislation. They're a good person, entryway into the department. But you can work with them early in the process. Now that you know that budget change concepts go to agencies in June, you want to talk to them before that because they're already thinking about changes to those programs. And use these words. Suggest that they propose a budget change concept. That'll get them thinking about the process. On a parallel path, prepare your same proposal for that legislative stakeholder proposal that we talked about. You're going to engage with the administration 7-8 months before. the budget's released. The legislative stakeholder proposal work actually happens when the budget's released. So they're on different timeframes. Next. So I think this is really helpful. If you, when you engage with the legislature after the Jan 10 budget is released, you can also make a budget ask this way. What you need to do is first find a legislative champion, and it's best to have a legislative champion, an elected official. So you want an assembly member or a senator, preferably one in the assembly and one in the Senate, to take up your topic and your cause. You go to their offices, you talk with their staff members, and you give them all of the information they need to understand why your ask is important. You also need to call the Senate and Assembly budget committees and ask, when is the deadline to submit stakeholder proposals, so that you can back out your process from that deadline. You need to draft letter of support templates, gather support letters from your supporters, and then meet with legislative offices, not just the one who's going to be your champion, but meet with the legislators who serve on those Senate subcommittees and Assembly budget subcommittees. Meet with their offices also to gain support for your proposal, and then support existing proposals. So in addition to actually proposing your own stakeholder proposal, you can support or oppose other stakeholder proposals. So you might have close colleagues who have a budget ask, and you want to put in a support letter for that, or meet with legislators in support to get them to support that ask. Same thing with opposition. If someone's put in a request that you don't agree with, you could then do the same process on the opposition side. Next slide. So what happens after May revision? People are really, really busy after May revision. May revision happens right around May 15th, and then they have about a month until June 15th, when the legislature is constitutionally required to send that budget bill down to the governor. People are moving really, really, really fast. So pay attention to the May revision, look at the summary document, look at the Health and Human Services summary document. You can send emails and meet with legislative offices, the legislative analyst's office, the relevant agencies or departments, and with their staff, meet with elected officials as needed. But just know everyone's moving really, really fast. So here, email and social media are definitely going to be your best friends. And to the extent you can, make sure you prepare your support letters and opposition letters in anticipation of that really, really fast process. Typically, the May revision comes out, 1 week, and the day after or 2 days after they're having hearings on that May revision proposal. It's really fast compared to the process after January 10th process. Next slide, please. And so for the California state budget, we've got a bunch of key definitions for you that you can read later. Next slide. And next slide. All right, so we're going to put up that next survey. Maria, do you want to go ahead and say something before we jump into our last piece of the process? I promise it's shorter than the bills and the budget process.
Thanks, Katie. There's actually some really good questions, so I don't know if we're in a place to be able to take them, but I think Janie has a really timely one about the GAN initiative and how that affects the budget. And for those of you joining us today, we did have an article. I think I read it on Fox 40. I got somebody else circulated it from the LAO, but the LAO has this projection that the governor's proposed budget this year is too ambitious, and they're sort of urging folks to tone it down a little bit. And so I don't know, Katie, if you have any additional information on the GAN initiative, how that impacts the budget, and if there's any insights you have about the current landscape and what we might be dealing with come the May revise.
Yeah, so we have the Center for Budget and Policy Priorities has a great explainer on the GAN limit, but the gist of it is, and Marissa can jump in if she'd like, but the gist of it is that the Constitution only allows us to spend a certain amount of money every year on the state budget. This limit was set decades ago, so you can imagine how relevant it is for an extraordinary time like this. But if we go over that limit, then we actually have to pay taxpayers money back. That can take many, many forms, and so that's what the governor, the Department of Finance, and the Legislative Analyst's Office are trying to dig in to figure out how we can spend a lot of money this year, taking into consideration the GAN limit. So we'll find that resource, and Marissa just put it in the chat for those of you who can read the chat, and we'll also, Maria, I hope we can make this available too. But
Yeah.
if you want to learn more about the GAN limit and become an expert in that, they have a really nice explainer on that. But it's a big deal. And just a note on the budget and the amount of money that we have to spend. This year and the prior year, last year, we have a wild amount of money to spend. And I say wild, like capital WILD. It is a lot of money. Typically, our state budget is roughly $250 billion. That includes federal funds, state funds, and local funds. So it's a lot of money. Typically, we have about $2 billion of general fund each year to spend. So you go, wow, $2 billion is a lot of money. Not really for the state of California, but that's why this process exists. How do we spend that $2 billion? This year and last year, we have more than 10 times that amount of money to spend. It's very atypical. You'll see a lot of stakeholder proposals, and that's why we've seen such an ambitious, this year and last year, such an ambitious budget proposal from the governor. There's just a lot. I can't emphasize enough, a lot of money to spend. It's very atypical. So I just want you to have that in your mind, because going forward, I think folks expect that to come back down and to have more of a normal is the wrong word to use, but maybe a much smaller amount of money in the years coming afterwards. So that's why the GAN limit is in play this year.
Thanks so much. And then there is a question from Susan about what is meant by an amount of money proposed in the budget as a quote unquote placeholder for a proposal such as senior nutrition.
Mm-hmm. Yeah, so sometimes in the January 10 budget, and the Governor Newsom has done this quite a bit, they will put out in January 10, they'll say, you know what, we want to spend some money, we don't know how much, on senior nutrition. Go. So what'll happen, they don't have an amount of money in mind, they don't have a program in mind, but what they'll do is the legislative committees will then take that and say, thank you, Governor, for proposing that. They'll agendize it, they'll put it in an agenda, and they'll have a committee hearing on it, and they'll ask questions and say, there's actually a whole process on the back end where the committee consultants meet privately with the departments and say, what did you mean about that placeholder? What is that supposed to be? And then the departments say, well, we actually wanted to put more money into CalFresh, into food stamps, or, well, we actually wanted to give money, I'm just making this up, but we actually wanted to give money to counties or area agencies on aging to provide meals to people based on income need. So they'll get more details. The committee consultant will take that conversation, write it up, and publicly and publish it in the public agenda document, and then they'll have a hearing on it where the department will come and say, this is publicly at a hearing, we'll say, this is what we actually meant by that. And then people will have an opportunity to give public comment. Typically when that happens, when the May revision comes out, so that 5 months later when they revise it, they'll actually put a number on that, on those types of placeholders. Or sometimes if there aren't enough tax proceeds, those placeholders will also go away. Because they won't have funds to spend on it. Yep.
Thanks. And then Carol, I see you've got your hand up, so go ahead and jump in whenever you're ready.
Hey, Carol. I can't hear you, Carol.
Yeah, you may need to unmute. And maybe Carol had to step away.
Okay.
But I want to also just note that there's a question in the Q&A about who decides in-person versus phone testimony in committees. And just for background, this is from Robin from the California Senior Legislature. And last Tuesday, he and his wife testified before the Assembly Health Committee on behalf of AB 2338. But it had to be in person. So I guess the question is, who makes that decision of whether it's in person or by phone?
Robin, that's a great question. Maria, thank you for lifting this one up. Typically, prior to the pandemic, all of the testimony had to be in person. And so phone-in testimony was implemented because of COVID. And so now we're starting to see a lot of that engagement go back to in-person engagement rather than phone or via Zoom. Marissa, do you have anything else, any other insights?
No, I think it's kind of a combination of committee, the committee itself, rules committee, the leadership in that house. They kind of make those decisions based on what's happening at the time and the different hearings. So, but you can always call the committees. You can always call the committees ahead of time to find out what the rules are going to be. Also, you can get someone to speak on your behalf as well, if that's possible.
Mm-hmm. Yeah, thanks, Marissa. That's a really good point. So if you have to travel or if you need, travel time to get to a committee, it's really important to call that committee to know whether or not they're doing only in person.
Mm-hmm.
Only in
also,
person.
Sometimes if there's a particular issue up that a large number of the public that should be engaging can't because of these limitations, if enough people call and say that this is a problem that we can't, that could sometimes change the process a little bit if it's possible, right? Mm-hmm. So.
Yeah, and it's always, I think, good practice to send in both a letter and show up in person for support. So if you can't show up in person, you can call a legislator's office, you can call the committee, you can email them, you can also send in letters of support or opposition. So there are other ways to engage, not just in that policy committee specifically.
Great. And Carol, I have your line open on this end if you want to jump in. And if not, we will move on to our, I think, next phase of the presentation. Okie dokie. And I will launch that next poll because I know either Katie or Marissa was going to bring it up. So here it is. Yep.
Awesome. Thanks so much. This is our last one. And as I said, it's much shorter than the budget and legislative processes. So thank you for that. And I did want to note that David put in the chat that he has testified by phone as a reasonable accommodation. So I think that that's really important too. Those are good, as you all probably know, but those are good keywords if you need to call a committee and tell them I need a reasonable accommodation, need to be able to participate virtually or by phone. David, thanks for that tip. That's great. So the last piece of our presentation here, so we talked about the legislature and policy bills. We talked about the legislature and the administration around the budget process. But what happens after a bill becomes a law, or what happens after the budget is signed? What happens with that? So there's a whole administrative rulemaking process, and it ranges from very formal to very informal. We wanted to use the California Health and Human Services Agency, no surprise, as an example of an executive branch agency where you might engage post-bill and during the implementation phase of either a bill that's been signed into law or a budget item. So the California Health and Human Services agency is huge. It has over 30,000 employees, has 12 departments, 5 offices, and addresses many of these services you see here. Healthcare, mental health, public health, substance use disorder services, income assistance programs, social services, and assistance for those with aging and living with disabilities. Next slide, please. Next slide, please. And these, for those who cannot see the presentation, these 2 slides just list out the Cal HHS offices and departments. Next slide, please. So what's the California Administrative Engagement Strategy? Next slide, please. So what happens after a bill becomes a law? If a bill is signed into law by the governor, the Department of Finance and the departments that are affected by that bill run really, really, really fast to create something called a legislative BCP. Remember how we talked about the process? There's budget change concept, and then there's a budget change proposal that happens over the summer. Legislative BCPs happen in the fall. The governor has to sign bills in October, which, as you can tell, is outside of that normal process. So these are special BCPs that are called legislative BCPs that are directly related to legislation. So they become BCPs and then they get funneled into that January 10 budget process. For bills that are being implemented, If a department needs to do what we call a regulation, they need more interpretation of the statute. They need to provide further instruction. The formal process for that is actually governed by the Administrative Procedures Act. And there's a whole California Code of Regulations behind this. The Office of Administrative Law is an office within the state that formalizes those regulations. So a department will say, you know, Assembly Bill 5 was passed. We need to, quote, promulgate regulations. This is anywhere between a 6-month to a 2-year process. Typically, it takes about 18 months. So it's a long process. And there are formal drafts and public comment opportunities along the way. So once a bill is passed, it's absolutely makes sense to call a state department and say, hey, are you going to have a regulatory process on this bill? And if they are, you should definitely pay attention to that public comment process. There are also informal rulemaking processes. Something that's very typical is that you will see in a bill, and a bill will be passed, say AB 5 again, and there will be a clause in that bill that says, notwithstanding any other law, this bill is exempt from the Administrative Procedures Act, which means that they don't have to go through that formal process. And instead, it will usually say this policy may be implemented via an all plan letter or an all county letter or an all program letter. That is a much more formal process, informal process, and you really need to work closely with the departments to understand, you know, if you see that in a bill, call the department and say, I want to participate in that process. Make sure you find out the staff person's name who is running that process and that you're on their stakeholder engagement list, and bug them about it. Say, hey, have we seen a draft all plan letter? I'd like to review it, and ask them for when they're drafting it, when they're finalizing it. That's the best way to get in there. I wish I had better information on how to engage, but it's a pretty informal ad hoc process. And so you really have to be an advocate and engage on that. And then finally, there's some federal processes. Sometimes things, particularly in the Medi-Cal program, they'll need federal approval. The state will need federal approval to implement a bill. So there might be a federal waiver or another federal process. And typically they require a 30-day public comment period. So usually there's a draft, and then there's the formal public draft, and then you can actually submit comments for 30 days. They'll give a 30-day comment period, and then they'll take in all those comments and do a final draft of that process. But above all, engage frequently with the relevant staff at a department, at an agency. If you feel like you're hitting a wall, call your state legislator and say, hey, I'm hitting a wall with this department. Can you send a letter, or can your office ask the department or agency to get back to me on this? That's also a very effective strategy. Next slide. And so one other way that folks engage, and some of you may already engage this way, is sometimes the state departments will actually put together formal committees. There's some standing California Health and Human Services Agency stakeholder engagement committees, and some of you or your colleagues may serve on them. Here, some of the relevant ones that I listed here are the Alzheimer's and Related Disorders Advisory Committee, the California Elder and Disability Justice Coordinating Council, the Disability and Aging Community Living Advisory Committee. There's also a Data Exchange Framework Committee talking about health data exchange, and then the Healthy California All Commission, or the Unified Financing Commission, or the Single Payer Commission. You've probably heard it referred to as all of those names. And then sometimes the departments will put out time-limited stakeholder engagement committees. It's a little murkier on how you get those, but typically each state department has a way that you can sign up for stakeholder updates, and they're pretty good about if you put your email address in, you'll get either every other month, every month they'll send out a stakeholder communication, and usually within those it says we're doing XYZ stakeholder committee, and then those typically have websites associated with them where they publicly post agendas and meeting links. Those meetings have been virtual. Because of COVID, typically they're in person, and I'm not sure how they're going to continue those after COVID. But as Marissa said, if you need a reasonable accommodation, or if enough people call, they might allow a virtual option. Next slide, please. And again, here's our favorite slide of the different ways that you can engage. So even in this post-bill signature, post-budget signature process, coalition building, letters of support, meeting with your legislators and departments, all of these strategies are still very effective as well. And that's it. I think we can go to some Q&A. And I know Maria is going to put up our last survey. Thanks, Maria. All right, so if you have questions, please go ahead and still put things into the chat.
Seeing none.
Seeing none. All right, everyone, we've exhausted you. Too much information. I hope you all found this to be helpful. I know it was Marissa and my pleasure to be here with you today. And Maria, thank you so much for letting us come and share this information. I know it's very high level. I know it's a lot. Thanks, Danielle. I see that great info in the chat. I just want you to know that we're here. Marissa and I are here, as is our team, on a case-by-case basis. If you have any questions, I know Maria is going to send out this recording and presentation and our contact information. If you have any questions, and it can be about this presentation. It can be about something specific. We're happy to be here and be a resource for you. So thank you for your time today.
Thank you so much, Katie. And if you're comfortable just sharing your email addresses in the chat, I think that might be really nice for folks to be able to follow up. I'm going to share, because I know that social media came up a couple of times as a great way to engage, and the collaborative has hosted a series of social media trainings over the years. I'm going to send a link through the chat to our social media trainings. Please check that out. It's done by a professional in the industry, and we're very fond of the way that he presents that training. I also wanted to reiterate what Katie shared about the materials and recording. We'll be getting that to you as soon as possible, likely next week, with Senior Rally Day and Advocacy Day coming up just around the corner. We'll make sure it's accessible to screen readers, and we'll add captioning to the video. So feel free to share that with your networks. This is, we're happy to have it circulated. And just a huge, huge thank you to both Marissa and Katie for sharing their expertise with us and taking the time to join us today. And thank you all for joining as well. And I'm sure we'll talk soon. Thanks, everybody.